Hi. Today, what I want to talk about is I want to talk about some foundation knowledge of how the musculoskeletal system, the movement apparatus, works and how it responds to injury. This way, the patient, you can help yourself better when you get into the predicaments of having some injuries or having some pains. Better meaning not just masking the symptoms, but dealing with it from a more foundation perspective. Pain's an unpleasant experience, and virtually everybody throughout life has pain. I think it's important to talk about so we understand where it comes from, so this way we can prevent it. Most pain comes from the movement apparatus. That is over 95% of the pain comes from there, which means only a small fraction come from your internal organs such as the kidneys, the liver, the heart, or somewhere else. Which makes sense because the pain receptors are found in joints and their supporting tissues such as ligaments and fascia as well as muscles. Which makes, again, logical sense, especially when we understand that the symptoms are the language the body can use to tell us that something is wrong we should pay attention to. So the movement apparatus, simply in the bones and the muscles attached to it that pull on them to make us move around, are most prone to get hurt because these are the parts of the systems that move around. So if we simply take medication, we mask an unpleasant symptom that way, we will often then ignore the body's message it tries to give us. And so I understand one takes an ibuprofen here and there to get by. However, if we keep masking the symptoms with it, such as like in a plant situation here that you can see, we only cut the weed instead of pulling out its roots. The weed will always grow back very quickly. In the body, if we just keep masking the symptoms without removing the root cause, a more serious condition will often come about and a disease or a more serious condition will happen. So if we instead learn to understand and then improve on the body's function, what we get long-term relief without always having to take another pill. So let's talk about some of the players real quick. The bones in the body stack on top of one another. The connections form joints, which are the most vulnerable part of the system. The joints are. They can break. Ligaments, as you can see here, some ligaments, they are like rubber bands reinforcing the bony connections. In an injury, such as like twisting an ankle or something, some of those connections get disrupted. Ligaments can even break. See here, some of the ligaments can actually tear when we twist an ankle really bad. Which what we get bones out of place, and often that are often unstable. When we simply take a pain pill, we're gonna mask the symptom, but we'll still walk on a twisted ankle, only reinforcing the problem and that way making it chronic. Until we figure out how to best untwist the ankle, so to speak, we don't remove the root cause and don't give the body the environment it can heal with. Does that make sense? Long-term postural situations, as we can see over here, also have a similar effect. They only creep up more slowly. I mean, we've all had to heard that we should sit up straight, but catch yourself when you work on a laptop. It's nearly impossible to sit up straight and working on a laptop. Muscles are also heavily affected in giving us pain, becoming dysfunctional. And it described both of the scenarios, either a macro trauma like the twisting an ankle, or also micro trauma like sitting for a long time in a crooked position. What the muscles do is they end up working either harder or they stop working efficiently and end up being limp or weak. So for example, if we overload a muscle, like over here, it's almost at the brink of tearing, what happens is the body turns it off completely, just like an electrical circuit breaker. At that point, the brain cannot communicate with the muscle anymore, and another muscle will have to take over its job. Let's say, for example, over here, see, these are like the wimpy ones. Let's say the glutes over here are weak. They're not working quite well. They're inhibited. At that point, the back muscles up here and the hamstring muscles in the back of the thigh will tighten up more. The good news is the body adapts and can still move around. just of course less efficiently. So when we push off now in walking, the hamstring muscle have to transfer the force straight up to the back muscles instead of the glutes helping. So it bypasses the glutes. So we can still walk, but over time, some of the other muscles will fail and become the next site of injury, like here with the hammy. Think of a twisted ankle. We often twist it again and again and again. That means we didn't treat it in the first place properly. Interesting is also if we have muscle tissue that doesn't work quite right, its shock absorbing quality diminishes. This is often seen when you look at arthritic knees or low back discolorations, like over here. See the low back? This is a nice one and this is an old one. That shock absorption is no longer taking place. So if these muscles will work, the shock going into the disc will be less penetratable into the discs. So in the orthopedic literature, we know that one of the back pain muscles, the deep stabilizing muscles, stop working and atrophy, and that leads to more rapid bony degeneration. So if we desire less pain in the long term, but also better performance and want to prevent injury in the future, it will be most important to look at all the functional components and improve on their working. The good news is we could do that. We could do that most likely less complicated, less expensively than surgery does or long-term pain medication does. So what we could do is we could put the bones stuck, back in the proper place, like over here. We have instrument adjusting. We have, depending, sometimes it's direct cracky type adjusting. Sometimes it's using pieces like the drop piece that helps move the bones back into the place. And that way we can make the joints move smoother again. What we also could do is you could loosen up muscles. Here we do some deep tissue muscle and a deep back muscle. That's great, and we could do scarring that way. We have instrumentation at this point that we can also use with that makes it very nice and comfortable. And best of all, more novel techniques like we're doing right here re-stimulate the muscle and bring the brain back into place and make the muscle be able to execute movement properly, or the body at that point be able to execute more proper movement by using the muscle properly. And so what we can do this way, we can work on your musculoskeletal apparatus, on the movement apparatus. And the great thing is that gives you really nice overall wellness, because if we can move around nicely, if we don't hurt in those joints as much, we can be more active, and that enhances the body health throughout all the systems. And guess what? With all the trouble we have created in treating these things only with pain medication, like look at the opiate epidemic, for example, the American College of Physicians themselves recently have changed in treating ailments this way, with also yoga and exercises and acupuncture and so forth, and only go to medication when it's intolerable. And so hopefully what we're doing, we're starting to use the pain or symptoms as a guide a little bit more than just as a thing we need to kill and get rid of. And so what I want you to get away with is that next time when you experience pain, remember that improving your function, your body's function, is the most effective way to get rid of that pain quickly and in a manner that it will stay away longer. Good? So that's about what I wanted to communicate, and if you have any questions, just ask me. You could see me at the office. If you're in school, you could see me after class, and I'm happy to talk about these things some more. Thanks.